Hi, this is Dr. Len Calabrese. I'm a professor of medicine here at the Cleveland Clinic Lerner College of Medicine and the director of the R.J. Fazenmeyer Center for Clinical Immunology here at the Cleveland Clinic. I'll now be discussing efficacy and safety of Ixekizumab in patients with active psoriatic arthritis. 3-year results from a phase 3, the Spirit P1 trial. This is presented by Dr. Chandran and colleagues. The study results were presented at EULAR 2018, which was just held in Amsterdam. I just got back from this fabulous meeting where I learned a lot. So the bottom line of the study is that in patients who were biologically naive with psoriatic arthritis, treatment with the IL-17 inhibitor Ixekizumab for up to 3 years resulted in sustained improvements in signs and symptoms of the disease. Importantly, there were no unexpected safety signals. The safety profile was consistent with previous studies. The importance of this is that with all of these studies of these relatively new agents, we want long-term follow-up. And this demonstrates, to some degree, a 3-year follow-up, persistent efficacy and safety. So let's take a dive into the methods. So this was a poster, and it reported on the extension phase of the 24-week Spirit P1 study. In this study, 417 biologically naive patients were randomized to Ixekizumab every 2 or 4 weeks or placebo. At 24 weeks, Ixekizumab was superior to placebo in improving the signs and symptoms of psoriatic arthritis. The primary endpoint of the study was the ACR20 at week 24, which is observed in 58 or 62% of patients treated with Ixekizumab, either at the 200 or 400 milligram dose respectively, versus only 30% of patients treated with placebo. 381 patients entered into that extension phase, and patients failing to demonstrate 20% improvement in tender and swollen joints at week 32 were discontinued from the study. So the key findings of this study were that 125 of 210 patients, that's 60%, initially randomized to Ixekizumab at week 0 completed 156 weeks of treatment. At 156 weeks, the following were observed in the 2-week and 4-week intention to treat groups respectively. So you saw a 62 and 69% improvement in ACR20, which is more than respectable, 44 and 33% improvement in the ACR70, an extreme endpoint. Importantly, the PASI 75, a robust marker of skin improvement, was improved in 69% and 63%. The PASI 100, which we, in previous era of previous drugs we didn't even look at, was improved in 61 and 44%. Now, very importantly, enthesitis and dactylitis were both improved, and they used 2 indices, the Leeds enthesitis index and the Leeds dactylitis index, and you can see that it was knocked down to 0 in 40 and 47% of these groups, and the dactylitis index was knocked down to 0 in 69 and 62%. The mean change from baseline in the HAC quality of life measure was minus 0.5 in the Q2-week group and minus 0.4 in the Q4-week group. And that's a significant and meaningful improvement. In the extension phase, a treatment emergent adverse event was observed in 76% of patients in the 2 and 4 week groups. The majority of these, however, were mild or moderate in severity. A serious adverse event occurred in 10 to 15% of patients treated with the active drug at 2 weeks and 4 week dosing intervals respectively. The most common adverse effect was infection, but these are mostly mild, observed in 49 and 48 of these 2 and 4 week dosing groups. The other adverse events, far less in the way of serious adverse events, and small numbers of patients with adverse events of special interest, such as inflammatory bowel disease like presentations. So what are my thoughts on this drug? Well, Ixekizumab is also a drug in the IL-17 inhibitor family. We now have 3 drugs available across the spectrum of psoriasis and attended complications. This is approved for psoriatic arthritis and psoriasis. 3-year data shows that it is persistently active and effective at a clinically meaningful rate. There were no surprises in the safety database. And the thing that I found most important in this is that there were impressive reductions in both enthesitis and dactylitis. And I will tell you that enthesitis, which is seen in the majority of patients with psoriatic arthritis, is something that patients are interested in. Tender joints might go down, but persistent enthesitis at the Achilles, or the knee, or the shoulder or elbow can be debilitating. So across all domains, this drug was effective. So this adds to the long-term use of this. I look forward to the 5-year cuts of these data. This adds the reassurance of my use of this drug and does not change my practice pattern.